And now I'd like to welcome the folks from Contra Costa County who are going to be talking about their Reentry Strategic Plan. And I have appreciated on this panel that we've had the opportunity to hear both about some macro efforts within the counties as well as some specific targeted efforts towards different types of offenders, which seems to have been a lot of the success that counties are experiencing. And so I'd like to turn it over to Jesse Warner, Paula Hernandez, Edie Elias, Dave Seidner, and Adam Poe.
Hi, good morning, everybody. My name is Paula Hernandez, and I'm the Assistant Chief in Contra Costa County Probation, and I'm just going to introduce our team here and get us started. The success that we're celebrating in Contra Costa County surrounding offender reentry, it didn't come quickly, it didn't come overnight, it didn't come with a few quick meetings. It's been a long and evolving and continually evolving process. But what's different for Contra Costa has been collaborative partnerships, shared learning, and mutual respect. In 2010, at the invitations of Supervisor Federal Glover and Supervisor John Joya, anyone and everyone who had anything to do with reentry and any part of the reentry process was invited to come together, county agencies and community partners, and create the county's Reentry Strategic Plan, which was adopted in the year 2011 by the Board of Supervisors, and you can find that on Contra Costa County Probation's website. About a month later, along came AB 109 and the CCP, the Community Corrections Partnership. We heard yesterday from Chief Penner about the importance of the CCP. In Contra Costa County, the CCP is chaired by Probation Chief Philip Cater and established productive and working relationships between the courts, the justice partners, the Board of Supervisors, and law enforcement. And the common goal for us was facilitating reentry and decreasing custody time. Right after that, and at the same time as that, with probation acting as the linchpin, AB 109 formalized partnerships between county agencies and community partners alike. The partnerships and the engagement of a community reentry coordinator, Jesse Warner, resulted in successful applications for Second Chance and Smart Probation, both federal grants, and they further defined the jail to community model for supervision, which requires regular and intensive communication of all of the partners to maintain our framework of success. I'd like to introduce David Seidner. He's our behavioral health manager in Contra Costa County, and he's going to tell you a little bit more about our partnerships.
Good morning, everybody. I lost a bet to Chief Cater, Contra Costa Probation. I didn't expect all of you guys to show back up. I thought we'd have less attendance second day. But it's okay that I lost a bet to him because he's paying us to say his name. So Chief Cater, thank you. That's twice. I just want to let you know. So I can talk about behavioral health, which includes alcohol and other drug services, mental health, our homeless division, and our benefit services. And really, before realignment, behavioral health was flat-footed. We were surprised. We knew about the problem. In mental health, we have about 10,000 individuals that we serve, and we knew about the criminal justice involvement. And I just have to be honest, we under-responded. We didn't acknowledge it, and we actually had poor outcomes. And what AB 109 did is it brought us to the table. We willingly came to the table, but we were also forced to acknowledge some of our shortcomings. So I'm going to identify 4 key factors from a behavioral health perspective that really speaks to better outcomes. And I will use the terms collaborative and play bingo with you guys. So the 4 really critical factors are dedicated staff, dedicated behavioral health staff. That really speaks to one point of contact. So within a system of care, you pick up the phone, you call somebody, you never get a response back. There are 500 employees within the behavioral health department. There's no way that a deputy probation officer can navigate that, nor a consumer. So dedicated staff is critical for dispositions, the feedback loop on the referral, the outreach engagement opportunities, and really that collaboration yet again. So the substance abuse counselor and the probation officer can meet up with that individual at a substance abuse program. The benefits specialist and the mental health clinician can meet that individual at a shelter. So really dedicated staff really solidifies planned intervention. The second factor is Pre-service engagement. So starting services while in custody is critical yet again. So there's in-custody deputy probation officers already identifying the individuals in custody, and then as the behavioral health staff, the substance abuse counselor, benefit specialist go into custody, they're starting applications. They're starting substance abuse services in custody. And really, they're creating that vision of community living. So when you come out, what are some things that are available? And I really do want to respect Deputy Todd and Marin. You got to have a bed available at release. So it's not just starting services in custody. Really, the proof is in the pudding, especially with the inmates that we serve. You come out, there's a bed available. You come out, the benefit application's been submitted, and hopefully funding is right behind you. You come out with medications, you have a 2-week supply, and we have a mental health appointment ready. If that stuff's not in place, your likelihood of success, your risk of reoffending, the whole kit and caboodle just kind of falls off. The wheels fall off of the wagon. So that's the second issue. The fourth issue, from a behavioral health perspective, is criminogenic factors. All service plans have to be universal. So it's wonderful to do case management. I'd love to help individuals get their driver's license. If that's your sole intervention, I'm not impacting recidivism, and I'm not taking reentry dollars to help people get their driver's license. I'm helping people get their driver's license and a whole continuum of services. There's a package. And we're going to be addressing criminal thinking, criminal affiliates, move people into pro-social networks and move them away from criminal affiliates. But that's training. That has to be informed. That doesn't just happen. And again, speaking about being flat-footed before reentry, and now we're in the business. The fourth issue that I want to really highlight, which I think is not unique to Contra Costa, but I believe it's one of our strengths, is really that transfer of service from behavioral health, a county agency. We're doing core, right? Medications, medical, shelter, and we're transferring the case into the community-based organizations. Okay, so this is a community response. So once we, in behavioral health, identify moderate, high, very high offenders, we're going to intercept with those guys in custody and psych emergency, and once they transition into moderate, low offenders, there's the community opportunity. We can't carry this by ourselves. We don't have enough dollars. We don't have enough staff, and that's not really genuine reentry. Reentry is community participation and having the community partners. So again, I really want to highlight what Chief Hopper said from Placer County yesterday. He's not paying me to say his name. He made a very critical point about service provision versus supervision. And that dedicated staff, having monthly case conferences, educating and bringing behavioral health staff up to speed to justice responses. We know our lanes. I'm here to do a specific thing. I have specific tools, and I'm here to help in a particular capacity. Once that individual is offered services and they're making choices, then that's a supervision issue. And really that's respect in terms of how we collaborate with our justice partners, probation, sheriff's department deputies. I'm running out of time. So what I really want to do is introduce Adam Poe, who's an amazing staff attorney for Bay Area Legal Aid, and he's going to speak to that community-based organization collaborative and that seamless handoff. Thank you.